All right, moving on to the next talk. We have a lot of New York representation. We've got to go to the other coast, so we've got Dr. Atul Madam. He's a private practice general surgeon in Los Angeles, so we're lucky to have you here today.
Thank you very much. I'm going to be talking, kind of switching gears a little, talking about mid-level providers. Although, as I did a little more research, I should have changed my talk to advanced practitioners, which I'll go over later. And if anyone has a nurse practitioner in their family or a friend, they understand why not to use mid-level, and I've learned that the hard way now. Disclosures, I have nothing to disclose. We'll get right into what is a mid-level provider. Well, you can see the two definitions that I got from the medical dictionaries. One is a medical provider who is not a physician but is licensed to diagnose and treat patients under the supervision of a physician. Actually, that's not true anymore because a lot of nurse practitioners can practice without any supervision now at all. The other definition was a healthcare provider, a nurse practitioner, a physician assistant, whose activities are directed or dictated by a supervising physician on whom liability for those activities rests. That's kind of important just to remember where the liability rests. But again, there are a few states now that allow nurse practitioners to be totally independent without any supervision, which we'll get to in a few minutes. So there's a bunch of different names: advanced practitioners, physician extenders, non-physician extenders. And they comprise a group of different healthcare providers: PAs, nurse practitioners, CRNAs, midwives, nurse specialists, and even nurse first assistants. And we're going to basically focus on the PAs and nurse practitioners for this talk. Now, the American Association of Nurse Practitioners vehemently opposes the use of mid-level providers and also physician extenders to be called, for a lot of reasons. And they actually have a statement out. And what they like to say, what they're emphasizing is they're licensed independent practitioners. And their scope of practice is really not so they're dependent or even an extension of a doctor. And then mid-level is kind of, the more I think about it, the more I read about this, I kind of agree. It is a little condescending because, I wouldn't want to go to a mid-level care. I want to get high care. And to say that they provide mid-level care or implies that they provide mid-level care is not fair. So what is a nurse practitioner? A nurse practitioner, and sometimes I get mixed up with these, so it's nice to go over the definitions of a nurse practitioner versus a physician assistant, which becomes important when you are thinking about hiring someone to help you out. Registered nurse with a master's degree. They provide direct patient care. They have to actually pass a national certifying exam, and they have to be licensed by the state. Some states have their own exam as well, and they have to participate in CME just like we do. And they also do get recertified. So they do learn more than just a registered nurse. They're also looking at clinical diagnosis, pharmacology, pathophysiology. They're usually in more of the primary care fields. And they focus more on health promotion than maybe a physician assistant. I put the website up there because if you are looking at trying to hire a nurse practitioner, you should probably go over to the website and see what they actually entail. This is a quote, what they like to describe themselves, or at least the website. It's independent practitioners certified to diagnose and to treat acute chronic conditions such as diabetes, high blood pressure, infections, and injuries. In all 50 states, they can prescribe medications. And most states, they can actually, controlled substances they can prescribe as well. And there are, like I had said before, some clinics that are solely run by nurse practitioner, and there's no physician involvement of any type. Now, a physician assistant, they're trained to coordinate patient care. They do require some degree of supervision from from a physician, and that's in all 50 states. Now, what kind of supervision it depends on the state. Some states require all PA charts have to be reviewed and signed by the supervising physician. Some only 10%. Don't ask me where they got 10%, but that's just how they do it. And again, they do not have to be physically supervising at all times. For the first year, they actually are taking the same class and room that many first and second year medical students take. The second year, they're involved in the clinical rotations. Today, most PA students actually have already had 4 years of experience before they enter a PA program. And just like nurse practitioners, they have to pass a certifying test, they have to get licensed by their state, and they have to do CME and get recertified as well. So most programs are a little over 2 years, and you see they take micro, anatomy, medical ethics, pathology, physiology. Unlike nurse practitioners, PAs you see more of them in non-primary care fields. Still not a lot. It's about a quarter of them are in the surgical specialties. Now, what's important to remember, most state laws allow the physician to determine how best to integrate a PA and how much to delegate, but every state is different. So depending on your state, you really should look, if you're going to hire a PA, what is allowed. In other words, most states allow history and physicals, but can they perform certain diagnostic and therapeutic procedures? It really depends. Some states, they're allowed to even do endoscopy. Some states, they're not. And it depends on the type of endoscopy. Most states will allow assistants at surgery, which is probably why there's more physician assistants for surgical specialties. And again, just like nurse practitioners, they can prescribe in all 50 states. And again, controlled substance in most states. It's kind of a side-by-side comparison I got off the web. And you can see there's about twice as many nurse practitioners as PAs. Most of them are in primary care, nurse practitioners. And there are a lot of programs out there. This base salary is from 2010. You can see nurse practitioners and PAs, they make about the same. It really depends on the area more than what degree they have. And nowadays, if you're thinking of hiring a nurse practitioner or any advanced practitioner, you're looking at spending about $100,000. So the pros, well, the number one thing is you can increase your income. And we'll talk about that in a few minutes. Number two, you can free up your time, which is actually, I think, sometimes better than increasing your income. For two reasons. One, you can operate more, which will increase your income. Or two, you can spend more time outside of work. And although we all love to stay in the hospital 24/7, we do like, some of us like to go home, I think. So, and that's a great reason to hire a advanced practitioner. But also, there's some intangible where you can't really quantify the benefits. They can spend more time educating the patients. I'm sure we all educate our patients very well. It never hurts to have someone else kind of going over things with the patient. It could actually increase your patient satisfaction by doing that. And you can expand your practice, because unless you figured out a way to be at two places at once, and if you have, let me know. It's really hard to sometimes run a practice. But before you are deciding whether to hire a nurse practitioner or PA, there's some questions you should ask yourself. Do you know your state laws and limits of what they're allowed to do? Scope of practice is very important. So you need to figure that out. Every state is different for both nurse practitioners and PAs. They each have different scope of practice. Then, to be honest, is your practice fully busy? Is your waiting room always busy? Do you have like days that are crazy? I just said one day, but do you have all your days that are crazy? Are patients complaining about the wait time? Are they complaining because you're stuck in the OR and they're waiting in your office? Are you booking new patients more than 2 weeks out? You know, I personally like to get a patient within less than a week into my office. Same day is even better, obviously, like Aaron had said. Are you trying to be two places at once? We all are asked to be at two places at once, but is that happening every single day? Can you spare the room? You know, are you in, is your office a multi-specialty office? Do you have more than one surgeon? Is there room for someone even? And the truth is, the big thing is, can you cover the first 4 to 5 months of salary? And in some places, it might be even a year before you actually see a profit on them. And then, are you able to figure out a hard worker when you interview? Because you got to figure out, you can hire a nurse practitioner, you can hire a PA. I don't think the title matters as much as the person. And you have to be able to be someone who can actually hire someone that's going to help you. Otherwise, you're going to get stuck with someone who you don't like working with. And that kind of goes to the opposite side of trying to find a job when you're trying to hire someone. Well, there are employment issues as well. And again, you have to check your state law. So anyone who has to do any hiring of anyone knows that you have exempt employees and non-exempt employees. Hopefully your state law says they're exempt, because otherwise non-exempt means you have to pay them by the hour. So if they're stuck in a case with you and it's 8 hours and it becomes 9 hours, now you have to pay them overtime. And there are very interesting rules about having to give them breaks. And if I think Target just having a lawsuit about that. Are they employees or independent contractors? Again, you should check with your CPA and attorney whether they're independent contractors or employees. Most of the time, they're going to have to be employees if you look at the real IRS rules. And then you have to let your malpractice carrier know your for your practice and your own. Most of your malpractice carriers actually ask you, do you supervise anybody? And mine asks I have to list everyone. Anyone who's a nurse and above that I employ has to be listed. Even if they're not your employee and you supervise, you really have to notify your malpractice. And then how much do you pay them? Well, there's websites for this. Salary.com is a great one. And then there's another one that I put up there that's basically a headhunter company that gives you pretty good data. It'll go over location, specialty as well. Obviously, advanced practitioners of surgery usually get paid more than the primary care. But how are you going to structure it? Are you just going to give them a salary, or are you going to give them a base versus incentive? That's something that you kind of have to look at your own economics to figure out. But expect to pay over $100,000 to them, which, you know, that means a lot more when you consider benefits and your tax that you pay and stuff like that. So how do you make money off of them? You have to figure out how to bill. Do you do incident 2? Incident 2 means basically that you get paid 100%. This is for Medicare, where you bill under your NPI number. They're doing some work. They cannot assess the patient first. You have to assess the patient on the first visit. You have to give a plan, and the advanced practitioner carries out that plan. If a new problem exists, you as a doctor have to go back and see the patient. There's split or shared services where you only get paid 85%, or they only get 85%, where you can bill. They can bill the same day that you bill. But all of that also depends on your payer mix. If you have a lot of Medicare, if you don't have a lot of Medicare. Some private insurers don't allow incident 2s. Some don't allow split and shared services. So you really have to look. You know, if you have 95% HMO, it might not be worth it for you to get a nurse practitioner or a PA, because you can't get them on the panel maybe. Then are you out of network versus in network? Totally different pay structure when you're out of network versus in network. If you do have if you have a lot of HMO contracts, are you fee for service or are you capitated? Will your private payers accept claims from an advanced practitioner? Medicare will give an NPI number out to nurse practitioners and PAs, but Aetna doesn't have to accept them. Anthem doesn't have to accept them. And then also, are they a hospital employee or your practice employee? Let's say you get the hospital pay for it. Well, they can't charge for first assist if they're first assisting you. Why? Because the hospital's already getting paid by Medicare. So that's included in the, if they're a hospital employee, you cannot bill for the first assist fees. If they're your employee, you can. So as you can see, there's a lot of nuances that you don't want to just tackle this on alone, and you really need to get someone, a healthcare attorney, to help you out with that. And then you want to also continually assess your billing. Every quarter, you got to see what's going on, and where are you making the most money off them? Is it in the OR, or is it rounding? Is it in the office? Now remember, that may not, even though you make more money in the OR, you might want them in your office. You just have to look at what's best for your practice. And you also have to look what's best for it economically. My personal bias is if your advanced practitioner is costing you money, you're not doing it right. You should always make some money off them. And I personally incentivize, I think, is a better way. They work harder that way, and just like we do. Kind of getting to the opposite side now of using a nurse practitioner or a PA. And this is actually it's a booklet from the Doctors Company, which is a malpractice insurance. And they kind of made this because they looked at they took data from the PIAA, which used to be known as Physicians Insurance Association. They did a 10-year period from 2001 to 2010, and they looked at basically liability claims. And what they found is over a quarter that involved PA or nurse practitioner resulted in a payment. It's kind of high. However, most of the payments, over half, were made by the supervising physician's policy or the practice. And the most prevalent misadventure or allegation was error in diagnosis. Now, most of these were primary care, but it's something you have to think about when you do hire someone. So I'm going to leave these up here so you can, if you want to take a picture, or if you get the slides, you can. But these are some tips to avoid malpractice issues. And this is straight from the Doctors Company's website. Basically, check your certifications. Make sure your staff know what nurse practitioners or PAs are going to do. Make sure the patient knows they're going to see a nurse practitioner or a PA. And you also really want to respect the limits of the scope of practice. Don't have your PA or nurse practitioner doing something that they shouldn't be. And I'll leave that up if you want to take a picture. But again, this is all in that brochure that the Doctors Company puts out, which I would not hire or think about hiring someone without reading that brochure or having that brochure. And in conclusion, advanced practitioners, they can add to your bottom line, increase patient satisfaction, and really give you some extra personal time. But you always have to be careful. You have to look at the state laws, the billing issues, employment issues, and obviously the scope of practice issues. Thank you very much.